Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thank you all for joining us in the Veterinary Breakroom. These are short conversations where we chat informally about relevant topics in vet med. And today we have, I guess you could say, a little bit of a heavy topic coming to you, and that is we're going to talk a little bit about rabies. There was a recent case of a organ donor recipient, so I guess I should say organ recipient, who came down with rabies and died. And that got me and Alyssa sort of thinking about, of course, all of the One Health aspects of rabies infection across the species, and sort of highlighted sort of how hard our job is as a member of the public health, and how it really often is our job to be a stop point in the transmission of rabies. Maybe not necessarily in this case per se, but we are one of the people on the front lines of educating the public about rabies. So for anyone who has maybe missed the story, Alyssa, I know you were the one that brought this to my attention. Do you want to fill everybody in?
Yeah, actually, the way this happened was really crazy, because about a week before I read about this story, I actually was talking with some colleagues about the last time that I knew about this happening. This is not the first time that there has been transplant-transmitted rabies. And so actually this is apparently the fourth transplant-transmitted rabies event in the US since like 1978. And I had just been talking with people about the case in 2004, because that was right after I graduated, from veterinary school. And in that instance, actually several people died. Unfortunately, there were 4 recipients of, I think, kidneys, a liver, an arterial segment, and they all passed away. But that was kind of the last time I heard of something like this happening. And then bam, a week later, it was in the news and in the headlines again that this had happened again. And so I think the case was confirmed in February of 2025, but the actual death happened at the end of 2024. The patient received a transplanted kidney from a donor, and that donor obviously had undiagnosed rabies. I think they traced it back to a skunk. In this case, though, what I thought was like incredible was once people started to figure out what happened, there had been other people who received transplants from that donor, specifically cornea transplants. And they got those people in, they removed their corneal grafts, and they gave them all PEP. And at this point, all 3 of those people remain asymptomatic. So while I think overall this was kind of it's very sobering, and I don't know, you can call it a public health failure, possibly. I do think that was, one part of this story that at least gave me a little hope that, there was something that could be done, and these other people appear to be okay. Thank goodness.
Yeah, it was a really interesting case. And there was another really interesting rabies situation that happened recently, too, that some of you might have seen in the headlines. And that was with a dog that was adopted from a shelter out of, I believe it was the Chicago area. He had been adopted in June, received his vaccinations, was adopted out in July, came to the shelter in June, got his vaccine. And then he was returned to the shelter because he had new onset behavioral changes, and there had become some safety concerns, and he was euthanized, and he got his sample came back positive for rabies. And so they were able to do, of course, post-exposure prophylaxis on everyone that was at risk because of him. I thought that was a really interesting case. And I don't know about you, Alyssa, if you had seen that one in the news, but what I really felt was missing was how wonderful it was that they had caught this situation. I know, especially in a busy shelter environment. And that's one of the reasons we wanted to have this conversation, is I know rabies can slip so low down on our list, especially in puppies that maybe are, he could have been susceptible to other infectious diseases because of his vaccine schedule, and just it's not always on our radar. And so that was something that was missed. And everything I read about this was how really those veterinarians at that shelter, whoever flagged it, really probably saved potentially some lives there, and how that really is an important role that we have. It's just another reason that being a vet is a hard job. And so I think it was a good refresher to me to say, hey, this is rare, but we are on the front lines. It's important that we remember what rabies looks like, that we don't just dismiss neurologic signs, or, if we have a patient who maybe can't do a complete workup and we wind up having to euthanize them, but we think we would have found something on the MRI, that, that just isn't always the case. And especially with things like vaccine hesitancy that are increasing, of course, increasing exposure to wildlife with urban sprawl and things like that, that this just potentially could continue to become a bigger and bigger issue.
Yeah, I do feel like I'm seeing just in the last few years more cases of pets that have tested positive, more large, public health outreach and groups of people getting PEP, post-exposure prophylaxis. I actually had post-exposure prophylaxis in my late teens because I had a run-in with a bat. And so rabies is one of those diseases that I've always been really passionate about. And I know we've talked on the podcast before about how Clinicians Brief partners with Mission Rabies. Back in 2018, I went to India on one of those vaccination drives. I agree with you. I think there's so much that goes into it, just kind of for a lot of these diseases. I think, they're kind of a victim of their own success, right?
Mhm.
Like we have done so much to make this disease so rare through vaccination, huge vaccination of pet dogs and cats during the 70s and 80s, that it really has dropped from, the kind of public eye. And so in that, I think there's a whole generation of people that, are not privy to, growing up with the fear of rabies instilled in them from movies like Cujo and Old Yeller. And I kind of joke, but it's not a joke, because obviously those, when you have cinema and literature and pop culture about something, it keeps it at the forefront. But I think especially in the United States, we just think of this disease as just gone, and it
Mhm.
really isn't. There is another thing coming up just for our listeners. It's actually coming up pretty quickly, but KSU is putting on a webinar, and we'll go ahead and link the registration for that on kind of a One Health initiative. It's actually for veterinarians as well as physicians, about our role and how we can bring rabies kind of more to the forefront of everyone's consciousness, and what we can do to make sure that some things like this don't happen, more in the future. So
Yeah, absolutely. And like you said, I think for so many of us practicing in the US or other countries that do have such low rabies rates, it does really get, like you said, victim of its own success. But then there are other parts of the world where that is absolutely not the case. And I know, like you mentioned, Mission Rabies and their goal is to eliminate rabies that's spread by canines, and how just in other cultures and other countries where this is still a big issue, that rabies really does impact that relationship with dogs too. There's just a lot of interesting cultural and societal things surrounding the disease. And actually, Alyssa, I know we were just talking about this, but when we brought up this topic, I happened to be reading this book. It's called Rabid, A Cultural History of the World's Most Diabolical Virus, by Bill Wasick and Monica Murphy. And it is really interesting. It goes really deep into the history of what this disease has done over different centuries, really, and how this disease has been found in history really since the beginning of human documentation. So if anybody does want to do a nerd deep dive, I think that book is really interesting, and it just sort of shows how the relationship with dogs and other animals was formed because of this disease. And it really does have you reflect on how lucky we are to live right now in a world where we can forget about rabies, and how for the vast majority of the time that people have been around, that just is so out of the question. And again, even for cultures and societies and geographic locations right now, that just isn't an option. So it was a good sort of gratitude moment and refresher for me that rabies absolutely isn't gone. And we're lucky to live in a world where we can sort of forget about it sometimes. And we will link some resources. I think the other thing I wanted to bring up during this discussion too is I know like we've all faced those phone calls or clinical situations where like has a pet been exposed? We don't know. Has a person been exposed? The dog bit someone? Are there neurological signs? I mean, you name it. There are so many frustrating scenarios when it comes to what is my role, my responsibility in terms of quarantine, reporting, euthanizing, submitting. I encourage everyone to sort of get your protocols in place before you get those phone calls. And I did find a really good resource from the CDC that we'll link in the show notes that sort of walks through a lot of those common scenarios and what to do and how to go about making sure that we are the little public health stewards that we are meant to be out there in the world.
Yeah, that's a very, very good point, Beth. And, realizing that a lot of these regulations do vary state to state. So just taking the time to go ahead and refresh yourself on, your locality, where you're practicing, maybe make sure things haven't changed. And obviously having, just like you said, having those protocols in place beforehand. There was a case here in Vegas that was really difficult a couple of years ago where somebody brought a dog in and they were placing an IV catheter pre-euthanasia, and the dog bit the doctor placing the catheter, the veterinarian placing the catheter. When they went to the owner and said, and they had no rabies documentation, so they went to the owner and said, we're going to either need to quarantine, for 10 days, or we're going to have to submit for testing. The owner took that dog, left the clinic, went to another clinic, and didn't tell them what happened, and had the dog euthanized there. And it was a giant public health mess. So, and so again, having all those resources, having your ducks in a row, knowing how to communicate to owners the importance of this is just something that doing that beforehand is going to save you so much anxiety or so much heartbreak like these clinics went through.
Right. Yeah, that's a good point, Alyssa. And even just protocols in place, like requiring rabies vaccine before nails, trims, or any simple procedures like that, the more we could do to educate on the vaccine end and prevent these really tricky scenarios or obviously worse outcomes, the better. So, Alyssa, I think that brings us to our win of the week. Anything you can think of this week that was a win for you?
Oh, well, so my win of the week is actually an upcoming win.
I'll take that, a preemptive win.
Yep, a preemptive win. So we're coming up on February is coming up, and so that is WVC season, and I'm excited. I'm registered. I need some CE, but also excited to see some colleagues, including, I believe you. I think you're coming out for WVC, so that's my win this week.
I will be there. That'll be my preemptive win. By the time we're hearing this, it'll already have happened, but I get to go to VMX and WVC this year. So like you, Alyssa, my win's going to be getting to do some in-person CE. I know I host a lot of virtual webinars, but there's nothing like sort of being in that old classroom environment that we all know and love at those conferences and seeing everyone, and getting to go to sunny Orlando, although I just saw it's going to be 33 degrees the day I land. So I think maybe with some sunshine to come throughout the weekend. So hopefully by the time we're hearing this, BMX has been a success for everyone, and we all of us Midwesterners got a dose of sunshine. So yeah. But anyway, Alyssa, this has been a great chat, and to our audience, thanks for listening in. We will catch you guys next time.
Thank you for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Veterinary Breakroom is an Instinct Science production, produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.